I'm Maureen Leahy, and I'm a nurse, a psychologist, and a marriage and family therapist. And I would like to talk about the work that I've done in Calgary, Alberta, Canada. And currently I live in Pugwash, Nova Scotia, which is on the complete east side of Canada. The two areas that I talk about are, one is the development of Nurses and Families, a guide to family assessment and intervention that I've written with Lorraine Wright, my co-author, good friend, colleague, and the development of our DVDs, the How to Family Nursing series. And then the other area that I'd talk about would be integrating family nursing into mental health urgent care practice. So for the Nurses and Families, we're just so excited being at the Family Nursing Conference and hearing all the presentations, including Calgary Family Intervention Model and Calgary Family Assessment Model. And one of the things that's so exciting is seeing it applied, not just globally, but in different contexts. It's actually quite humbling and a bit overwhelming. The How to Family Nursing DVDs were Lorraine and my effort to actually show nurses how to interview families, or how we interviewed families in actual practice, because it's one thing to read about it in a text or hear about it in a lecture, but it's another to really see it in practice. And so we developed a website, FamilyNursingResources.com. The area of clinical practice that I have been in is mental health, and I and a colleague, Sandy Harper Jakes, developed a way of integrating family nursing into mental health urgent care, so that the family nursing was not an add-on, but was actually integrated. And so in the job postings, it included the words family nursing and a bit of a description of what we did in the program in family nursing. In the job interviews, we'd ask people, tell us about your family nursing experience. If you had a family, a teenager come to the mental health urgent care, how would you approach the teenager, hoping that the interviewee would talk about families. During the orientation, we included sections about family nursing and mental health. Then we have live supervision of people's practice. We're fortunate enough to have one of the mirrors. And then on a monthly basis, we've had seminars in which each staff member, like one month, one staff member chooses an article, another staff member chooses another article, and comes up with a vignette, and then looks at the practice. And what we developed was a framework: mental health nursing, physical health nursing, integrative behavioral health, and family nursing. So as a way of tying together the various elements, as Benner would talk about it, specific domains of practice. And really it's quite exciting. And then we developed the ladders, so that when we published this in the Journal of Family Nursing in, I think it was 2011 or 2012, in looking at how a nurse, say, who came from the emergency room, might be very skilled in physical health assessment, might be moderately skilled in mental health assessment, but really at a novice level in family nursing. And so we were able to sort of diagram people's skill levels, and this became open conversation, like, go to Joan, she's great on physical health assessment, or it would be talk with Mary, she's worked on inpatient psychiatry for years, and who was good in family nursing. And then in the performance appraisals, that again was part of the format for the performance appraisal. How were they doing on mental health nursing, physical health nursing, family nursing? And I had the good fortune of being the manager and started the program so that I could hire people who wanted to do this work. And I get that that's a real advantage, because sometimes you have staff who have been around for a while, and then to try and help them to change is not easy. But in planning programs, I think it's very important not just to isolate family nursing, but to have it integrated as well. The idea of showing outcomes where family nursing is important.